So, hi, welcome. Okay. I'm going to be presenting a lot of information tonight. I will make available the slides afterwards, so we'll get those posted with Rebecca. As we're going, I am comfortable with you saying, oh, hold on, can you repeat that or explain that if it's something that is going to hold you up. Otherwise, we'll talk about it at the end. Okay. I thought I'd tell you a little about myself and my background, and then I'd love just to get a quick sense of who's here, ages, and kind of questions that are on people's minds. But as Rebecca said, yeah, I've been at the clinic for, well, I started when my daughter was 6 months old, and now she's a junior in college. So it's been a while. I also have a 12th grader who's getting ready to launch to the next phase of her life as well. I do focus on anxiety and depression, as well as a number of other issues that come into the clinic. Most of the time I spend at the clinic is doing therapy, doing sessions with kids. And I'm also actually just today started co-leading another round of a program called the SPACE program, which is a parent-focused intervention for anxiety. And we'll actually be talking about that a little bit more tonight. I'd love to get a sense, maybe just by a show of hands, who here has a child who is 6 years or younger? Okay, awesome. How about 10 years, 6 to 10? Okay. How about middle school, kind of that 11 to 13-ish? Okay. And how about parents of high schoolers? Awesome. Okay, great. So we've got a real nice variety. Obviously, the topic of anxiety, I think, applies across the developmental age span. And we'll talk about that as we go as well, because there are differences in how it shows up, how it looks at different ages and stages. So, quick sense, are there any burning questions that really motivated you to come tonight? Are there things there's just one thing you want to get out of tonight? What might that be? Anyone want to be brave and offer that up? To better understand anxiety. Awesome, especially not having firsthand experience with anxiety, but having family members who do. Awesome, yeah, great. So what's kind of the range of garden variety sort of worries, anxiety versus what might merit help or intervention? Great, okay. Like, yes, cutting through the stereotypes, especially if it's not really obvious, but maybe more hidden. Yeah, yeah, great. Yes, and then yes, you first. Okay, so a kid who might be outwardly up and happy or bubbly, but seems to have a hard time maybe talking about what's going on underneath at a level. Yep, yep. Thanks. How about you? Okay, so supporting transitions and also managing high expectations or maybe some perfectionism. Yeah, yeah. Good. These are great questions. I hope that we're going to be able to address most, if not all, of these things. And again, I'm glad to stick around after we're done with the formal presentation, answer some questions, okay? Or even point you to some resources for follow-up. So, cool. Okay. Well, let's roll. So I tried to organize this talk around a few key questions. So really beginning with some definitions. What is anxiety? How does it impact kids, parents, and family systems as well? So we all have a sort of a sense of our own definition of anxiety, but kind of what does that look like and how does it really show up in the lives of families day to day and kids specifically? And also, how can we support? That's really the key, right, tonight. In the title of the topic or title of the talk, we really hope that you're going to leave tonight feeling more confident in your ability to both understand and support your kid. And we're going to talk about what are some realistic expectations. What are we going to achieve when we talk about supporting kids? Does that mean we're going to eliminate their anxiety? Probably already know the answer to that is no, we're not going to eliminate it. But what does support look like? And we'll try and give you a framework for what that can be. You know, as far as anxiety goes, and I think this is a good thing, there's been a lot of popular press. So there was this cover story in The Atlantic a while ago on anxiety. Awareness of increasing rates of anxiety, especially among teenagers. More recently, sort of almost from a public health perspective, recommendations of more universal screening for anxiety, which I think this is all to the good. And I just know from talking to kids, they themselves are very dialed in and aware of anxiety. Many people, including kids, will self-identify, have a lot of anxiety. I have OCD or whatever they might have. So let's just do some differentiating fear from anxiety. So when we think about fear, we're really talking about kind of a hardwired propensity to react to a danger by becoming sort of revved up or aroused, that so-called fight or flight response, right? Anxiety, though, what we're talking about is a reaction to a perceived threat, right? So it's an imagined threat. It's not necessarily something that's happening in the moment. So it oftentimes is about an anticipation about something coming up that might be dangerous or just uncomfortable. And someone asked really about this idea around what's normal, when is it, maybe merit help. So as psychologists, mental health folks, we consider a disorder, it's an exaggerated response to a situation that's not actually dangerous, right? It may feel very scary, but it actually is not going to pose a real harm to the child. Right? And by disorder, we think about a psychologist's functional impairment, meaning does it get in the way of life activities? So for a kid, teenager, what are life activities, right? Going to school, doing chores, engaging with friends, having fun, those sorts of things, right? Or if they have a job, working at their job. As well, we consider disorder when it causes really significant subjective impairment. So if the child is in a lot of distress, even if they're still able to do the things that the world asks them to do, if they're really miserable, we also consider that to be a disorder and something that sort of rises to the level of needing some intervention. Of course, where exactly is that line can be hard to determine, right? A lot of kids kind of suffer in silence. And so to the point of folks who are asking, sometimes this can be very subtle and can take some time to sort out and figure out. And you may ask a child, are you worried? Are you anxious? And they may say no, but you're seeing other kinds of signs. And we'll talk about that as well. We're not going to go into tons of detail, but I will point out this is a brain of a human. And the reason I'm putting this up here is just to illustrate that there's a lot going on in terms of complex interactions between different brain structures. The cortical areas, so the cortex is sort of the outer layer of the brain, and the subcortical stuff is the stuff downstairs. We'll call back later to the upstairs part of the brain and the downstairs part of the brain. The key idea here is that there are stimuli in the environment. It might be something that the person sees or hears. It could even be something they think about, and that sets off a cascade of neurochemical events, hormones, stress hormones, neurotransmitter action, and then that leads to some kind of an emotional or a behavioral reaction. Okay, so there's a lot of complex stuff going on, but the idea is that there's some external event that triggers a reaction, and we're really going to be working with how can we support a more useful set of relationships between those events. So as we said, behavioral, cognitive, and emotional and physiological effects all are going on to make an anxiety response. It's important to think about when we're seeing anxiety and seeing behaviors that represent anxiety, why are they there? What is the function that they're playing? Two key things. One, especially for a child, a young immature human being, that they're there to communicate upsetting thoughts and feelings, primarily to us as caregivers, right? And it's also then to motivate us to do something to help resolve that anxiety state. Okay, so there's a psychologist and author who invented the space program, which I'm going to talk about in a couple minutes here, named Elie Leibowitz, and he gives this example, which I think is great. So suppose that you're carrying your baby, and I go up, and I would not do this, okay, and I scare your baby, right? What is the baby going to do? Cry and hide their face, maybe look to you, cling to you, right? So this is a very good thing that an infant human is going to react by seeking comfort and soothing from the caregiver, right? This is an innate response. That's a fear response, right? So the behaviors that the child does are meant to reduce their distress by turning to us because that's our job, right? As caregivers is to provide comfort and soothing. So when we see among non-babies, teenagers or toddlers or older kids, anxiety responses, we also always want to go back to at its core, there's something very functional, that anxiety is about trying to seek reassurance and to resolve the uncomfortable feeling, okay, which we're going to talk about a lot more. So epidemiologists and researchers have good reason to think that rates of anxiety are increasing. Not just that people are talking about it more, or not just that it's more prominent on TikTok, but it's actually the rates are rising. And there's lots of theories about why that might be. We won't go into them. I think the real answer is we don't fully know. There's probably a lot of different pieces going on. But if we don't recall, there was also a pandemic, and that I think boosted rates of anxiety as well. We think that roughly 1 in 3 kids will have an anxiety disorder at some point in childhood, and at any one given time, roughly 3% meet criteria for a formal diagnosis of an anxiety problem. We know that ADHD and anxiety are among the most common mental health disorders between 3 and 17 years old. Roughly 1 in 11 kids have one of those conditions, according to the CDC. So these are not uncommon. The Pulse survey was something that the CDC did, I think, during the pandemic to kind of get a sense of mental health. And this is pretty striking. Like 37% of adults surveyed reported feeling anxious and depressed, as opposed to before the pandemic, it was 11%. So I'm guessing no one here is surprised by that. Children of anxious parents are statistically more likely to develop anxiety than those of non-anxious parents. Interestingly, though, genes, depending on how you look at it, they account for, or they only account for 30 to 40% of the risk for anxiety. What this means is that genetics is not destiny. So if you have anxiety, that does not mean that your child will necessarily have it. As well, I want to emphasize that this is not about wanting to induce guilt or feelings of over responsibility. If your child had diabetes, you probably wouldn't necessarily feel guilty that they have diabetes. You would still be motivated to learn about how to manage it and support them, help them figure out how to live with it. That's the model we want to use with anxiety as well. Let's talk about ages and stages. So as we were alluding to earlier, we know that anxiety looks different across the developmental age span, right? So in infancy, stranger anxiety, protesting, getting upset or distressed when separated from a caregiver. Also, just things that are startling or surprising or novel can induce anxiety or fear in little ones. As kids get out into the world and have more kind of exposure to peers and school life experiences, um, understandably, the kinds of things that they worry about start to change. So, for example, with a growing brain becomes greater capacity for awareness that sometimes scary things happen, right? The pandemic, for example, or natural disasters. Children may also begin to worry about bad things happening to the family, especially if they're exposed to peers who might have had some difficulties in their own lives. And then moving on, with teenagers, adolescents becoming so much more social beings, some of the more socially related kinds of anxieties tend to crop up. Worries about being embarrassed or not doing as well as peers, things like that, as well as sex and intimacy, just the future. I do a lot of work with adolescents, and worries about what am I going to do when I grow up, or am I going to get a good job, or am I going to get into the college I want to go to, things like that. This is certainly not an exhaustive list, but something that we often look for that kind of tips us off to anxiety-related school would be kind of the Sunday night stomach aches or not feeling good, waking up Monday morning, stomach headaches, those somatic complaints. Kind of pulling away, trying not to be noticed at school, more irritability on school days or school mornings. Declining performance at school, not being able to get the work done, can sometimes be a sign of or caused by anxiety. Anxiety about evaluation and tests. Procrastination. This is a tricky one, right? Because what's going to be the result if you put off doing your work? Are you going to feel better or worse? At first, you're going to feel better, and then you feel worse, right? And so we get into this trap, right? This avoidance cycle, which we're going to talk about more. And in more extreme cases, school refusal, school avoidance, which is a really tricky trap, again, related to the previous point. Once you start falling into avoiding school, missing school, you get this temporary relief paired with an increased anxiety, which could fuel more avoidance. And so we really can struggle with that, both, I think, in our families, but it's, to be fair, not to dishearten you, but it's one of the trickier things to get a hold of clinically as well. It can be done, but it's tough. I wanted just to kind of highlight the fact that when our child or children are experiencing anxiety, it really can have an impact on us. I suspect that could be related to why some of y'all are here tonight, right? As a parent, we might feel guilt. I would argue, as a psychologist, inappropriate guilt. I don't think that parents deserve to or should feel guilty for the challenges their parents or their kids are experiencing. We may worry ourselves about our child's worry, which can set off kind of this cascade of reciprocal worry, that their worry fuels our worry. Our intensity and worry can make them more anxious. And so we kind of get this mirroring effect. We may feel sad, and we ourselves may start to avoid situations that might trigger our child's anxiety. So we start to kind of restrict what we're asking of them or what our family is able to do, right? So if you have a child who really struggles to do things, say, out in public, it would make sense you'd start to restrict how much you go face those situations, which can be tough for parents. Within a family system, if you're co-parenting, or if you have other family members kind of observing your parenting, there can be kind of the blame game about, well, you're not hard enough on them, or you're too hard on them, and that can be a tough situation when certainly all the caregivers need more support. We can, if you have more than one child and one of them has anxiety and one of them does not struggle with that, we can kind of get this accentuation of these sibling roles where one of the kids is like extra good. They kind of like polish up their halo and they're just like problem free, where the other one is sort of the more difficult child. As I noted earlier, we can kind of get this like polarization where two caregivers kind of pull the opposite direction. And so we talk about the canoe. You try not to tip the canoe over. So one parent leans that one way. Well, then that's going to make the boat tip that way. So the other parent's going to lean that way. So you can get someone being overly permissive or overly demanding, right? So it kind of keeps some semblance of stability, but it's hard to get anywhere if you're both leaned out opposite directions. So of course, we're trying to get more of a central tendency pulling in the same direction. Families can, of course, become isolated, and as I noted earlier, we start shutting down the activities we do. Okay, I've mentioned Leibowitz in space a couple times. Supportive parenting for anxious childhood emotions. This is really cool. I'm not going to go into it, but I encourage you to read about it. It's one of the new evidence-supported treatments. And the nice thing about this is an intervention just for parents to help children, right? Children who are not available to or refuse or decline to participate in treatment, parents can participate in this and we can get some good effects. We have found, or they have found, the folks at the Yale Child Study Center, that it's effective with 7 to 14-year-olds. They're also looking at applying it in other age populations too, even to young adults. The idea here is that we try to increase support of our children while decreasing accommodation of the anxiety. We're going to talk about both of those concepts next. Okay, so this is an accommodation cycle. So let's say Adam, it's a school morning, backpack is downstairs in the basement. Parents say, okay, grab your backpack, there you go. And Adam says, oh, I'm too scared to go alone to get my backpack. Well, parents in the service of getting to school on time are going to go with him. He's going to get the backpack. We'll get to school on time, which is a good outcome, right? Except the conclusion that Adam may reach, even if it's sort of subtle, is he may think the only way I can get things from another room is if my parents come with me. So that works, and the parents continue to accommodate, and Adam continues to avoid facing the discomfort, the fear of going down to the basement on his own. So if we overlay this with kind of these steps, basically we see how distress related to an anxiety problem drives family accommodation, and then you get this short-term improvement in distress, right? Well, if you get that improvement, that's going to lead to continued dependence on the parents for regulating the emotions, and then the symptoms are maintained. So we can see how this is a cycle that feeds itself and it's hard to break out of. An important point here, accommodations, they are natural. Good parents accommodate, right? It's hard to see our children suffer, and so we do everything in our power to reduce that suffering. And actually, accommodation may actually solve the problem. However, you may see this coming already, it is a temporary, it's a short-term investment in the anxiety system. Drawbacks can include symptoms are maintained, as we saw with that backpack example with Adam. And kids don't have the opportunity to learn how to cope a little bit more effectively and independently. It also maybe sends a message to the child of, we know you're not up for this task. We know you're too scared to do this, so we have to do it with you or for you, right? Well, that's a great question. The tricky thing, the research, yes, was done with 7 to 14-year-olds, but this concept of when is it appropriate to ask children to face discomfort on their own is very dependent on who the child is, the context they're in, their skills, and their developmental level. So for some kids, they need more support and kind of co-regulation, and it's hard to know exactly where's that dividing line where, okay, now you're old enough to do this on your own. So for example, who can say when is the child old enough to sleep on their own? I don't think we can answer that question, right? When is Adam ready to go down to the basement? So it's going to be a very individualized kind of decision that every family has to make. In space, basically what they say is when it has a significant interfering effect and it's going on and really getting in the way of the family, that's when it's that we identify it as a problem. But we have to take the child's developmental level into account. Basically, two flavors of accommodation. One is participation, where we join the child and sort of engage in that sort of anxiety dance with them, like in the example of Adam, or modification, where parents take actions that basically prevent the anxiety situation even from coming up. So, for example, if Adam's parents always kept the backpack at the front door, right, that would be a modification of the way the family works. And again, none of this is to say that accommodation is wrong or that we should not accommodate. I think we should. The point is that when we're overly accommodating or we're not really aware of how it feeds into the cycle, we can get into these traps. So basically, we get this sort of tension between two things. One is the fact that our job is to protect our children, right? And on the other hand, our job is to promote our children's ability to live in the world, right? So we get this tension between these two roles. How do we resolve this? Because if we're sort of stuck in this place, caregivers can get stuck in this fluctuation between kind of overly being protective, but also then on the other hand, frustrated and angry and come on, you need to do that, and kind of over demanding. So you can kind of get this flip flopping back and forth. We're of course trying to find the middle. So support, effective support, blends and balances these two different values, these competing values. So what does that even mean? What is effective support? Okay, so in space, they talk about the mac and cheese statement. So basically, just like you can't have mac and cheese without mac and cheese, you can't have support without two things: acceptance and confidence. It's acceptance of the child's feeling, of their fear, of their legitimate emotion, but it's also confidence that they can handle slightly more anxiety than they're currently experiencing, right? So it might be, we know you get scared when we don't come with you to get things from your room, acceptance, but we're sure you'll be okay. That's the confidence, right? And again, the space program goes into a lot more detail about kind of how to pull this off effectively. So don't go home and think, that's it, I'm not helping you anymore with this, that, or the other. But wanting to sort of plant the seed of there's ways that we can really name and validate and legitimize the emotion, especially anxiety, that our children might be feeling, while also helping them feel more capable of managing it. Sometimes we worry, depending upon our own belief system, maybe on how we were raised, that if we acknowledge the fear, we're somehow going to make it worse. We're going to get more fear. Actually, it tends to work the other way around, right? We can acknowledge it. We find it does not make it worse. It usually makes it better. There may also be a concern that if we validate, that means that we're now going to be supporting the anxiety or agreeing with it or feeding into it. And that's not true either. We can acknowledge a feeling without sort of saying you should be fearful, right? Or we're going to therefore do this for you. We may fear the child's response. They may throw a tantrum. They may be upset. We don't like that, or that can be very distressing or even anxiety provoking for us. You might try being supportive and it doesn't work the first time, so why bother doing it? Well, of course, all skills take a lot of practice, especially adding new things to our parenting repertoire. The basic idea here is that, I call this is the shape of anxiety. Anxiety tends to increase and peaks, and then it goes down again. That's basically what happens with anxiety. It happens with actually most emotions, to be honest. It builds and it goes away. Might come back again, probably will come back again, but temporarily it goes up and down. So what we're really trying to do is support kids from getting to the I can't do it to, I'm willing to go through this so I can kind of get on with things, get on with my life. Okay, has anyone, raise your hand if you've seen this hand model of the brain before? A couple people, okay, right. So this is kind of a handy visual reminder. So the structure of the brain is actually pretty analogous to this, sort of a fist with your thumb wrapped in. So here, going from bottom to top, the wrist represents the wrist and the palm represent the spinal cord, kind of the biological functions that keep us alive. The thumb is the limbic system, kind of the seat of emotion and behavioral responses related to survival, that fight flight response. And then the prefrontal cortex, that represented by the fingers, that's the part behind your forehead here, kind of the higher order functions, executive functioning, thoughts, feelings, and actions. So we put this up to represent this idea of when we get really, really aroused, we flip our lid. So the thinking part of the brain kind of goes offline, in some sense, literally, and we're in this limbic state, this kind of hijack of the downstairs brain over the upstairs brain. We're going to hold on to that and come back to that in a minute. We are going to talk about some general suggestions, then dial in a little bit more on some concrete strategies. As we've been talking about so far, avoidance is kind of what makes anxiety tick. So we have to be very mindful about making a deal with the anxiety where we try to do a short-term strategy to make anxiety go away if it's going to further the anxiety down the road. So we want to avoid avoidance as much as we can. We want to try and shift towards not feeling like it's our job to solve all of the anxiety or discomfort that our children feel, but we want to move in more into the role of an emotion coach, observing, connecting, validating, as well as supporting them coming up with ideas on how they can face or overcome the challenges they're facing. It's really helpful when we are in control of and aware of our own trigger points, our own emotions, and to really, if we need to, get some support with that, rely on a friend, other support systems, so that our own worries, our own anxiety, we don't kind of put them on our child or have that interfere with our ability to be effective coaches to our kids. As we're saying, we want to really think about, are we trying to respond to the child's upstairs brain? Are we talking at them? Are we giving them suggestions when their thinking is offline, that they're just kind of flipped, right? If we ourselves are really upset and flipped, it's going to be hard, if not impossible, to be very supportive or useful to our kids. So if that means we have to step away for a minute, calm ourselves down, take a break, that's oftentimes a really good strategy. Getting a little bit more specific here. Based on the last point, we want to always start with the downstairs brain before we do a lot of talking and engage with the upstairs brain. So that means we want to try to connect. We want to use a soothing tone. If you have a child that responds well to physical proximity or touch or other physical measures to comfort them, do that first before you tell them what they should do or start trying to give them ideas with your words. If you have a kid who that's going to make them more upset, don't do it. Give them the space they need. But we really want to focus on connecting first, kind of calming down before we sort of launch in with some sort of thing. Now, as a quick aside, I want to acknowledge, if you're on a timeline and there's some demand that's really pressing, that's going to make this harder. And paradoxically, that's oftentimes when anxiety tends to crop up. Transition points, getting out the door, on a deadline, things like that. So we kind of have to balance what's possible with what's required by the situation. And there may be times when we have to say, you know what, I'm just going to push through this. There may be other times we say, I'm going to prioritize what my kid needs right now. What they need is to sort of take a little break. Yeah, your own triggers. Yeah. So, for example, let's say I'm really worried that my kid's not going to go to a good college, whatever that means, right? And so if I see them struggling with homework, I may bring a lot of intensity to that, and I may get anxious if they get a B or a C on an assignment, something like that. So just being aware of what our own buttons are, what makes us anxious, can help us be more effective in helping our child who's dealing with anxiety. So for instance, if the child is more worried about, say, performance, but as the parent, we're more accepting, right? Yeah, I'd say that's less of a, as a parent, I have to manage my own trigger point, and I think that's more to kind of work with them on maybe some more flexible thinking, kind of exploring, challenging their thinking a little bit. But again, picking the right time. So if they're kind of freaking out and really upset, it's going to go over their head. We have to find the right time where they're calm and more receptive, right? If you can get your child to slow down and do take a few deep breaths, that is likely going to help. And there's lots of different techniques for relaxed breathing. But again, along the lines of getting the downstairs brain under control, we want to kind of help regulate that physiology. So if they can do some things like sit down, take a walk, get moving, use their senses to distract themselves temporarily, help them identify things they can see, they can hear, they can smell, just to kind of break out of that brain lock that can happen. That can be a very useful approach. The challenge sometimes, I'll be honest, is buy-in. Sometimes kids do not want to hear a single thing. That may be the kid. You just need to give them a little bit of time and space, and then manage your own worry during that period of time, or your own frustration. Maybe it's not worry. Study after study supports this idea that physical exercise and movement really helps with anxiety. One of the last abstracts I looked at suggested that they got similar effects of anti-anxiety medication compared to regular exercise. Right? I'm not saying that that's going to work for every kid in every case, but I think it's really compelling. And many of us have our own experience with, you usually feel better after you get some exercise or at least some fresh air. So really thinking about the physiology piece of this. Yes, and to be, I don't think that there's an agreed upon amount. It does tend to be that more intense aerobic exercise tends to be more effective than, like a lot of kids that I work with. Well, I get plenty of exercise. I walk to school. Like, well, that's great, but that's not what we're talking about. We're talking about really kind of getting your heart rate up and sweating a little bit. I usually recommend, at least 3 times a week for, 20 minutes plus. It's probably one of the things that within reason, the more the better. Name it to tame it. Has anyone heard this phrase before? Helping your child use their words to express what they are feeling or thinking. You're really feeling worried about college right now, or you're really feeling, worried that your friends are not going to approve of you, right? Whatever that is, putting it into words often can make it more manageable. And at the very least, it can help communicate to us what's going on inside. Again, you may have a kid who resists this. That's why we have to have a lot of other alternative strategies. I talk with a lot of clients about the what if formula. So what if worries? What if worries are notoriously difficult to manage because anything you can come up with, the anxiety can overwhelm it. So for example, what if there's an earthquake? Well, there won't be an earthquake. It's very unlikely. Okay. But what if there is, right? Well, the odds are incredibly low. Okay, but they're not zero, right? So we can kind of get in this trap of trying to provide reassurance or using statistics or logic, and the worry, in my experience, will beat it every time. Instead, what we're trying to do is we chop off the what, and then we say, if this thing happens, then what will we do? What would that lead to? Now, I kind of regret that I picked the earthquake, because that's a big one. So, well, we'll start digging, right? But what if I do badly on this test? Okay, well, if I do badly on this test, what would we do? Well, maybe I could ask for a retake, or I could do extra credit, or I could study harder the next time, or I can get a tutor. Right? There's usually a lot of solutions we can come up with, but if we just try to provide reassurance up front, that tends to be pretty ineffective. I talk a lot with clients about cool thoughts versus hot thoughts. Hot thoughts, those are the thoughts that get us revved up, that kind of help us flip our lid, that activate that downstairs brain. So we want to practice cool thoughts, and emphasizing that cool thoughts don't mean happy thoughts. So a hot thought would be, it'd be awful if I, failed this test. A cool thought might be, it would be disappointing if you failed the test, but I'm sure you can handle it. Kind of back to the support statements. And we want to be mindful about what we as the parent, as the caregivers, how are we talking about our own worries? So if we come home and we are griping about our day, or talking about how stressed we are, or this thing that we're really worried about, we're kind of subtly contributing to kind of more of a hot thought culture in the family. We're not talking about just being Pollyanna and saying everything's great or there are no problems in life. We know that's not true, because after all, we're trying to help kids feel more capable of managing things. So if you can keep this in mind, that get kids, what is it, learn more from what's caught than from what is taught, meaning the things we don't really think that they're necessarily listening to or picking up on, they really may be much more so than these lessons that we're trying to teach them. This is one of my favorites, is focusing on the things inside the green circle. What are the things that I can control? I can control what I say, what I do, my effort, how I respond to mistakes. I can hopefully control my behavior. All the stuff in the outer ring, we can't control. What do people think of us? What are people feeling? Are other people, making mistakes? So notice that your kid is getting trapped in that outer ring. If you can kind of help redirect them towards the middle. Again, as I keep emphasizing, timing is everything. That if they're flipped, that's not a good time to use a strategy like that. But I think this concept can be really valuable. Finally, I want to emphasize this idea of a struggle switch. So just for a minute, imagine that there's like a switch in your brain, and that switch is on or off. When it's on, we're struggling and fighting with and rejecting unpleasant feelings and emotions. When the switch is off, we are more accepting of those thoughts and feelings. It doesn't mean that we like the feelings. It doesn't mean we approve of them or want them. It just means we're not fighting them off, okay? Make sense? So if we can get the struggle switch off, it's basically like we're dropping the rope. We're not saying I'm not worried. We're saying I am worried, but I'm going to quit trying to push the worry away. Because if you haven't ever had this experience, the more you try to not think about something, the more sticky and stuck that thought tends to be, right? So we're going to try and drop the rope and acknowledge, validate, kind of back to those mac and cheese statements. We want to connect to our child. We want to validate the emotion they're feeling. Rather than talking them out of the worry, we want to acknowledge it. I can tell you're really feeling upset right now. We can use those support statements we talked about earlier. I can see you're upset, and I've seen you do hard things before. I think this is going to be one of those times. And we can also identify what's important. In other words, I'm sure people in the room have had this experience. You've been really stressed or worried about things, but you've still been able to do the things you need to do, right? You can probably make dinner for your kids if you're in a bad mood, right? You can still. Has anyone ever gone to work when they didn't feel like going to work? What's that? Every day, every day. So trying to help kids orient not towards making the feeling going away, but identifying, well, what's really important and what's a step you can take towards that important thing. Taking those meaningful actions, either what's helpful, what's needed, even if it's a small step. Okay, so we're going to boil it down to just a few core summary points. Anxiety is complex and challenging, but really it is a normal, healthy response. So we don't want to view it as an enemy. We want to view it as something that is just a part of being a human being, and not be scared of the fear, not be scared of anxiety. The more we understand it, it can help us become more confident and more skillful in managing our own and our child's anxiety, helping them be a coach. And by accepting the feelings and demonstrating our confidence that they can manage their feelings, that puts us in the most powerful position for supporting kids. And again, to that last point, we talked about the kind of the cool thoughts and modeling, our own coaching and modeling. It's really invaluable. So we want everyone to hopefully leave feeling like you already, before you came in, you already had skills and abilities to help support your kids. And by continuing to understand this stuff, I think we're in a better position to keep supporting them. We're going to end the slides there and kind of shift to an opportunity for folks to ask questions if you'd like. We noted earlier, we've recorded this session. This mic is picking up only my voice. So if you'd like to ask something, you're welcome to. And if you'd prefer to wait till we're like all done, the camera's off, the mic's off, I'm happy to stick around another couple minutes as well. But how about any general questions? So the question of if you have a kid who's triggered by words, they've maybe heard it all before, they know when you start talking, they're going to hear something they don't really want to hear. How do you connect? I guess I'd sort of go back to this idea around timing of that if you can do some seeding some of these ideas during good times, depending on the age of your kid, I often recommend like drive time is a great time because you don't have to have eye contact. So while doing an activity, kind of gently sliding something in, or even acknowledging, I know it kind of drives you nuts when I talk about these things, give you suggestions. I also feel stuck on how to help you sometimes. And we talk about that, right? So sometimes just acknowledging that dynamic can be really useful. Depending again on the age of the child in question. How old? 12, yeah. That's an interesting age, right? Because they're really smart. They they have a lot of growing intellectual abilities. Finding ways to empower them to identify, well, what is it they want? If they don't want to hear you talk so much, but they don't like how they're feeling, are there things that they're needing or wanting? What ideas do they have? I think kind of empowering them to take some responsibility for how they want to feel. Yeah, good question. Other people, yes. In short, I'd say if the anxiety is, this is going to be a little bit vague, long lasting. So by long lasting, we're not talking about they've had a rough few days or a rough month or so. But if this is something that really month in, month out is a problem, and if it's growing, if it is really getting in the way of their ability to do life. So, for example, for a child, going to school, doing activities, participating in the life of the family, um, but, and as well if it's causing the child themselves a lot of emotional upheaval and stress. Those tend to be the cut points where I usually recommend maybe starting with the family doctor, the pediatrician, bringing that up, and potentially thinking about, is this now a time to get some support? Yeah. Test anxiety. Yeah, I mean, that's actually the nice thing about test anxiety is that tends to be relatively more straightforward to help kids with. That may not, I wouldn't think of test anxiety as a long-term professional help kind of situation. It could be, a handful of focused sessions with a really good tutor who knows it, test anxiety, or with a counselor who knows how to work with that. Yeah. It's one of those things that depending on the age of the child, buy-in is very important. This may go without saying, but of course, if the child themselves is open or wants the help, great, provide the help. Yeah. So, I mean, these days, I don't know if we have any school counselors in the room, but I mean, I think sometimes resources are strapped so much so that school counselors end up not doing as much counseling as one would think. But they're often a great resource to begin with, and they may even have recommendations for tutors, other therapists, things like that. Yeah, so it's always a good bet to start with them. Right, right. So if the child is by herself, parents are not around, are there some strategies that we can help the child with? Some of this, of course, will depend on the age, right? But I guess there's sort of two thoughts I have. One is, without being unsympathetic, is it okay for the child to be anxious, right? Can they handle that anxiety? And so some of it is a normalization of like, yeah, that makes sense. You'd be feeling anxious, right? Um, but if we're talking about like really severe anxiety that escalates or becomes very distressing to the child, that may be more where we need to pre-plan. I think it's probably easier if you know this is a pattern and can do some planning ahead of time. Obviously with communication technology, phoning a parent, phoning a friend, that could be something, or phoning, right? Texting, FaceTiming, whatever. I think, again, depending on the age of the child, having them pre-identify what are some of the things, if you start to get nervous or worried, you're going to do. Because again, for many of these situations, kids themselves already have some ideas about how they're going to feel and know what will work or what won't work for them. Mhm. Right. So if you as the caregiver really, because you've seen them since they were little, right? So you've seen the whole trajectory, and so if you see something that's in this case like social anxiety starts turning to avoidance, and then they get to a point where like I don't care, it doesn't bother me. I think this is a very tricky situation because you can't. It's going to be difficult to keep rolling a rock uphill. It's going to keep rolling back down again. At some point, the child needs to make a decision for themselves about how important is this to face. I think this would be the kind of thing where looking at that parent accommodation cycle could be helpful, right? In other words, if we're doing things that make it easier for the child to not face social situations, then we think about, are there ways we can sort of pull back from that a little bit? If there aren't really any accommodations going on, the child's not as social as we wish they were, or we knew they would be capable of being, then that might be one of those things where we have to give it time, right? There has to be some degree of motivation, especially from an older child, right? Where they have determined for themselves what's worth it. Sort of that, remember that worry hill? They have to have something on the other side that they want to go through the discomfort to achieve. And if they haven't yet identified what's on the other side, we're going to be a little bit stuck, I think, at least temporarily. Yeah. It's a tricky one. It's a really good question. Yes, the role of social media with anxiety. It's a complicated answer. The short version is there's pretty good research that excessive use of social media, so the word is excessive use of social media, tends to drive anxiety, especially for girls, not exclusively, right? Um, but yeah, there's been a fairly consistent research finding that that overuse, and there's reasons we can imagine or that they've posited behind that. There's a lot of social comparison that happens. There's a fear of missing out or being left out or excluded, body image issues, things like that. Um, on the other hand, we don't want to take social media and make it into a bad guy and into a boogeyman. That we know that social media can really connect kids. I think a lot about balance. And my colleague Sean Marshall, I don't know if anyone heard him last time. He has expertise in social media and electronics, video games, but it can be a great connector. So I think as part of like a balanced diet of activities, I think it can be fine. But I think that excessive use, yeah, can certainly be linked to increased anxiety around. But maybe we'll take one more question if anyone wants to ask one. Yes, differentiating just general teen angst versus something more, right? Especially that might need attention. I mean, there are a couple of obvious ones I'd say that I'm sure we would all pay attention to. So if you hear something that really concerns you, if you hear something about, I just, it doesn't really matter if I'm here, I'd be better off dead, or I'm thinking about suicide, that's a red flag, right? That's, I mean, unfortunately, I think we've to some extent normalized some of that stuff, and severe teenage depression is not a normal expected thing. Many teenagers do go through mood swings and maybe a down day or two, but we don't want to normalize or accept significant depression. Um, More along the lines of trying to sort things out. What's the meaning? Where do I fit? I think, again, I'd go back to that. Is there kind of functional impairment that happens? So does it keep them from trying new things? Does it get in the way of them participating in school or other kinds of activities? Um, but so again, I think about severity of the impact and the longevity, how long the impact lasts. If it's something that's, kind of more of it comes and goes, I'd say that's probably a little bit more developmentally typical. If it's something that's pretty persistent or starts to kind of shrink down their activities, that's where I'd maybe look into it more. Yeah. So yes, right. So almost any level of anxiety, almost independent of the issue, as a parent, if you can be modeling that could really have a positive impact on the kids. Yeah, yeah, I agree, and that's a great point.